Okay, I've been wanting to dive in a little deeper into insulin resistance, and one of the people I follow on actually LinkedIn is Amanda, and she really goes into insulin resistance a lot, and I love her platform. So I wanted to share her with you to help you be fit and healthy from the inside out at a cellular level. So, Amanda, thanks for coming on the show and talking about your mission, your purpose, all of that to help us thrive as we age.
I love it. Thank you so much for this opportunity, Debbie.
Yeah,
Um,
well, just dive in. Let's just get going. What do you what are you passionate
who am
about? What's
I?
your goal?
Yeah. Well, yes, my name is Amanda. I'm an integrative functional medicine pharmacist and an Insulin IQ coach. I conventionally train as a pharmacist. I've been a pharmacist for 30 years.
Mm,
Through my own health challenges,
mm,
I have autoimmune conditions. My daughter's has Hashimoto's, has PCOS. Both of my parents have passed away from complication due to type 2 diabetes and kidney failure. So I have the what you consider the bad genes. So, but I'm not doomed, right? I
yeah.
refuse to succumb to just because I have bad genes, I'm set to get type 2 diabetes. Yes, I have the bad genes. I have predisposed, disposed genes, but I have control. I have control. So
Exactly.
through lifestyle, right? Through
Yeah.
lifestyle modifications, through diets, through movements, of course. And today, my passion is education, raise awareness on insulin resistance. As you can see, my poster here, insulin resistant is at the root of
Yeah.
most of these chronic illnesses that I have been dispensing medications to manage, to treat those symptoms, but not really teaching people that you can heal, you can reverse, and you can prevent all those conditions. Because if we just spend time treating each one of these conditions, we're not addressing the root cause. You treat
Hmm.
one, another one's going to pop up.
Yeah.
So, my
Now,
mission today, yes, it's to help people heal from the root and address insulin resistant and restore metabolic health naturally, not
mm.
with medication, but with food, with lifestyle, with supplements, targeted supplements.
And that's opposite of what you learned as in pharmaceutical, because this is where you're pushing drugs. So did you work with insulin for type 2 diabetes as a pharmacist?
No, I've been in the community pharmacy in the retail space,
Mm,
dispensing a lot of medications,
hmm.
insulin, metformin, cholesterol medication. So I've just been dispensing medications to help people manage, but not really working in, with a specific population in the retail space. But since my own health challenges, I now working with clients who have type 2 diabetes, who have obesities, who have cholesterol issues, everything that's related to metabolic health. My
Hmm.
journey started with my own health, restore my own autoimmune conditions through functional medicines. That's what set me into this path because I had IBS, I had leaky gut, I had psoriasis. My daughter had PCOS, like acne, hair loss, weight gains, eczema, all the symptoms associating with it. And I couldn't help myself. I couldn't help my family. Doctors will only prescribe medication. So I had to step out from my own, um, conventional training and learn alternative other modalities to help restore my own health. And that's how I end up in this functional medicine space. And then I found Dr. Ben Bickman on Why We Get Sick
Yeah.
and start my journey with insulin resistance. I'm part of Insulin IQ
Hmm.
community. And earlier January 2024, my mother-in-law started having Alzheimer dementia
Mm,
um, symptoms due
hmm.
to insulin, due to being a diabetic for 15 years,
Hmm.
been on a statin for cholesterol for 20 years. And her doctor recommended that she get her foot amputated because her toes, the wound was not healing. They amputated the toes due to cancer, and the
Mm-hmm.
wound was not healing. So they wanted to amputate her toes, and we're like, okay, wait, let's see what we can do. And then I found a simple protocol, two supplements that I tested out earlier this year that Dr. Bickman did a study on.
Mm-hmm.
And we tested out, and I was able to help her save her foot, reduce inflammation. She lost 20 pounds, and
Yeah.
I can show a picture. Um, got off medication, got off metformin, got off all her diabetes medication, reversed her type 2 diabetes in 8 months, and got off most of her medications and lost 20 pounds and saved her foot. So that's why, like, this year, I've just been out there. That's how you found me, right? Because I'm in there every day,
Consistency is
LinkedIn.
the key.
Exactly. So
Yeah.
just trying to raise awareness and let people know that there is hope, that there is a natural, sustainable solutions that you can, if you want to.
Mm-hmm.
If you want, you have to put in the effort. Of course, I can provide you the information and the tool, but you, the person, has to put in
Yeah.
the
Do the
effort
work.
in order to
Mm-hmm.
heal, because healing is an inside job, right? You know, a doctor can't really heal you. They can provide you the information, they can make recommendation. A coach, I can only provide the information. I can't heal you. Only you can
Mm-hmm.
heal you. It's like it coming
Mm-hmm.
from the inside. So,
Yeah. I think that's why, is our practitioner world, there is a new certification, board certification, to be the health and wellness board certification requirement for a lot of jobs now, because
mm-hmm,
we need to add that in. And I wish I did that in college, that we had that way back when, because you can't really get people to have behavior changes and change what's required to reverse insulin resistance unless we guide them and not tell them what to do, because it's not very effective for
mm-hmm,
majority of the people, right? So it's just
mm-hmm,
interesting at how many roles are jobs in our field are requiring this national health and wellness board certification, which I took the course 6 months. Is really just interesting psychology, how you have to get people to understand what you're saying, that you have to want to make the changes. We can't get you to wake up and start this morning routine, or how you start
mm-hmm.
your meal, to take some breaths, to be relaxed and focus on digestion. I mean, it all starts with us giving you the tools, but then how you apply them is such a process, and it's a big journey for a lot of people, because we can't just give you a pill and solve all the problems, right?
That's what we've been trying to do for the past
Yeah,
30,
doesn't
40
work.
years, right? Yeah, it doesn't work. That's why we have the twin
The root cause.
epidemic today of type 2 diabetes and obesity. That's um, research shows, the CDC um, indicate that 93% adult Americans have prediabetes or
Mm,
insulin resistance, and most people don't know that they have it.
yeah.
So, like, how many people do you know have a little bit weight around the belly, have maybe skin tags or dark spots underneath the neck or armpit, um, adult acne, chronic
Mm,
fatigue, anxiety, depression,
mhm.
all these,
Yeah.
all the symptoms.
So let's go into what is insulin resistance and how is it related to type 2 diabetes. And then we can go into signs and symptoms a little bit more, as you just mentioned.
Sure, sure, yes. So insulin resistance is like the buzzwords now, right? If you go on
Yeah.
social medias, insulin resistance is all over. So insulin resistance is a state where is a state where there's too much insulin in the
Mhm.
bloodstream. Not really that you don't have enough insulin. There's too much insulin, known as hyperinsulinemia, meaning that you have too much insulin in the bloodstream, that the cells now is resisting to insulin. So every time you eat, doesn't matter, it will convert into glucose. But if you eat carbohydrates, processed food, of course, those will elicit a higher glucose response compared to protein, compared to fat. So fat, like it listed, about 10%, protein about 40%, carbohydrates like 90%. So what you eat matters. And so every time you eat, it will convert into glucose. And then that will signal the pancreas to put out insulin to bring down glucose, to put the glucose inside the cells. So that's how we get energy, right? So, but if you eat processed food, carbohydrates, eat too many times a day, what happens is like the pancreas will have to keep putting out insulin to bring down the glucose. And then over time, you'll have too much insulin in the bloodstream, and this will lead to insulin resistance. So, on an average, if you're an insulin sensitive person, it will take about 3 to 4 hours for the insulin to come back down. But if you already have insulin resistance, it'll take about 8 to 10 hours for the insulin to come back down. So, if you start your day with a big bowl of cereals and sugars and fruits like many of our children are having today, it can just set you up for a whole day of high insulin. And this will set you up for insulin resistance. And how many people do you know like eat every 2 to 3 hours or snacking all day long? I was that person. I used to be a snacker.
Yeah.
And
Yeah.
so
So you're
that
saying high glucose throughout the day or high insulin?
high insulin, because
Mm.
insulin is required to bring down
Yeah.
glucose and to open up the cell doors. So imagine this is your cell, right? So when you eat, you have glucose, and then insulin has, I mean, every cell has an insulin receptor. So
Mm.
pancreas will put out insulin, insulin will come open up the cell door and to bring in the glucose, and that's what
Mhm.
give us energy. So what
Yeah.
happens is that when you have too much insulin out here, the cell refuse to respond to insulin. It's just like when somebody keep knocking on your door, first you
Yeah.
open the door, right? But if they keep coming knocking on your door every 2 to 3 minutes, you're gonna say, I'm gonna just ignore you. So that's what's happening.
Yeah. And, and I always like that analogy. If people don't know Ben Bikman, make sure you read his book, Why We Get Sick. And his
Mm-hmm.
new book is
Mm-hmm.
How Not to Get Sick, right? Isn't that the new
Mm-hmm.
one?
Mm-hmm.
Yeah.
How not
And
to get
he
sick. Yeah.
has, if you want to really nerd out on all this, he has a YouTube channel called The Metabolic Classroom, which he has a new website, Dr. Ben Bikman or Dr.
Yeah.
Ben Bikman. And
Yeah.
it is really, if you want to get deep into more of the science part and feel like you're back in college, that is my favorite podcast because they're just 30 something minute videos that he does and he explains everything so well. So you're like, oh, now I get it. So,
Yeah.
yes.
That comes
And
directly from our classroom, by the way, that
yeah,
we
the
pay
insulin.
for.
Yeah, insulin
For
IQ.
like
I know. I thought that. I was like, oh, I'm
insulin
going to watch
IQ,
this before it's taken away because it's probably not supposed to be
right?
free.
Yes, yeah. No, it's wonderful. Yeah. So he would just, weekly come and give us the lecture and record it and then put it out into the metabolic classroom for the public. It's
Hmm.
free. So yeah, it's a great source of information on metabolic health.
So, insulin resistance. So that's a good definition of what it is. Why do you feel like if that you've been in the pharmaceutical business, I feel like we're told type 2 diabetes, your glucose is high, you take insulin to lower it down. And
Hmm.
I feel, I mean, I'm sure all of us in the functional medicine space, we're all in it because you're passionate about it, but it's so misleading. And the type
Hmm.
2 diabetes, the
Hmm.
guidelines are kind of, don't you think, opposite what we're supposed to be doing? And it gets you dependent on insulin when really it's not that we have too much insulin, it's that we need to change some other things.
No, it's not that we don't have enough insulin. We
Yeah,
have too much insulin. So
exactly. I said that wrong, but we don't need to
yeah,
supplement.
so exactly. So what I do at the pharmacy, I dispense insulin injection in
Hmm.
order to bring down the glucose, right? We're
Hmm.
glucose centric, focus, and which is we should be insulin focus,
Yeah.
right? So we should be teaching, I shouldn't say should, try not to say should. We want to teach clients, patient, we want to teach them how to eat, what type of food to eat, to bring down insulin, and intermittent fasting is the quickest way to bring down insulin. So
Mm.
instead of adding insulin with injection to bring down glucose, what if we bring down insulin and eat more fat, protein, and fiber so that we don't spike the glucose to begin with? Every time we spike those glucose, insulin's going to get dumped. And that's going to sometimes, like when you spike, you're going to crash. So
Mm-hmm.
what we want to eat food that will gradually increase the glucose to give us sustained energy instead of that spiking and then crashing. And so when
Mm-hmm.
you crash, when you go into the hypoglycemic state, is when we have these symptoms of fatigue, brain fog, hungry, hangry, right? You just want to go grab something, and most likely many people will grab sugary food or carbohydrates, processed food, and
Mm-hmm.
that will spike again and crash.
Yeah.
Yeah.
It's just sad to me always that, I just went trying to get a doctor do our annual checkup that you get
Mm-hmm.
covered by insurance. And it really, my husband was supposed to go today and he didn't have an appointment. So anyways, he got the wrong day. But I was thinking about how the annual checkup we're supposed to do, our physical, is to be preventative of
Mm-hmm.
diseases. And really, I was thinking about today that we're really not getting any good information from our physical, what we're supposed to be preventative and really looking at the right biomarkers that we talk about. But what do you feel in Insulin IQ, Ben Bickman's teachings, what we should get tested and measured periodically to avoid getting insulin resistance and type 2 diabetes, as insulin resistance is a pre-diabetes basically before we get type 2, and then
Yeah.
type 2 is reversible. So what would you think
Yeah.
we should be
Great
getting
question.
measured?
Great questions. Yes. Ask next time you go in, ask your doctor to measure fasting insulin.
Mm-hmm.
It's you can get fasting insulin. It's just not readily order because there's no medication
Yeah.
to treat insulin resistance, right? And here's a kicker. It takes about 10 to 15 years for the insulin to keep rising, rising, rising before you get that high A1C, because every time you eat, right, the insulin will come out and bring it down. And and this can happen over 10 to 15 years before the cells resist enough that
Mm-hmm.
the insulin is not, it can't do the job well, so
Yeah.
that you'll see the presence of elevated A1C. And that's when you get the diagnosis of prediabetes, type 2 diabetes. So that's not really prevention, is it?
Yeah.
Prevention, you want to ask for fasting insulin, and you want
Mm-hmm.
that number to be less than 6. If that number is greater than 6, you can do something about it. You can eat more fat, protein, and fiber, or more, protein and healthy fat focus. Um, Dr. Bickman saying is like prioritize protein, don't fear fat, focus on fiber. That's his saying. All
Yeah.
right. So if you learn to eat like that, you won't spike the glucose. And this is how you can bring down insulin, but practice intermittent fasting, time restricted eating. It's not meaning that you're eating less. You just want to eat less often so that you don't spike the glucose, and allow the insulin to come down. And insulin is a fat storing hormone. Insulin is a growth hormone. So people who are trying to lose weight to try to be more metabolically flexible and healthy, if they don't address insulin, if you don't bring insulin down, you will never be able to lose the weight. I mean, I had clients came to me, it's like, Amanda, I'm not eating anything, but I keep gaining weight every week. It's like, yeah, well, one, there's stress. Two, there's inflammation,
Mm-hmm.
and what kind of food you're eating when you do eat. Even though you're not eating anything, if you're insulin resistant already, it doesn't matter because insulin will signal the body to store energy in form of fat. So until you practice that intermittent fasting, allowing the insulin to come low enough that your body will tap into your own stored fat. And that's how you can get rid of the love handle.
With more the fasting method, you're saying like a 12-hour fast to 16 hours?
I normally
Yep.
practice 16-8, 18-6.
Mm-hmm.
Um, yeah, so, but you can start with 12, 13, 14 hours. We already practice intermittent fasting, but we don't call it that way, right? When we sleep throughout the night, we're fasting, right? And
Mm-hmm.
that's when our body goes into rest and repair. So what
Yeah.
we want to encourage is to extend that a little bit longer, a couple hours, a little bit longer. Skipping breakfast is common for many of us. But if you have type 2 diabetes, if you're on medications, you want to work with somebody, you want to work with a practitioner, make sure that you don't go into the hypoglycemic state and slowly transition, pushing back breakfast an hour each week and then eating more fat, protein, and fiber, able to stabilize the glucose. And this is how we're able to help people come off of medications slowly and safely.
Yeah, I like to think of breakfast, lunch, dinner means movement time, not eat. And I rather talk about meals to get people to switch to saying meal one, meal two, meal three,
Mm-hmm.
because I think
Mm-hmm.
there's such bad relationship with breakfast means I'm going to eat cereal, muffins, scones. Doesn't mean that like this morning I had some salmon. That
Mm-hmm.
people
Mm-hmm.
don't think they think breakfast has to be breakfast foods, lunch is lunch foods, and then dinner
Mm-hmm.
foods. Like I kind
No,
of
mm-mm.
change that, right? It's just like
I love
why
it.
do we think that way?
Right.
Just
I mean, breakfast mean break
break fast.
fast, right?
Yeah.
It doesn't mean a bowl of cereal and sugars. That's because it's like what the breakfast company, the cereal companies came out with
Hmm.
us,
Yeah.
slogan,
Thanks.
want you to eat cereal for
Yeah.
first thing in the morning.
Standard American diet.
Yeah,
So
absolutely.
the
Yeah.
other thing you mentioned too, I think, is what we're chatting about before we recorded. Other sources of insulin resistance, or not sources, but causes of insulin resistance, is not just eating too many carbohydrates. There's other reasons for it. Could you speak to any other issues that can
Absolutely.
relate
Yes,
to?
stress. Stress is a big one. Stress is a big one. When you're in stress, when you're in a sympathetic, dominant state, stress, you
Mhm.
can increase your cortisol level, and cortisol will convert into glucose. Glucose will convert into store glycogen in form of fat. So that can lead to, and that's a factor that can um, lead to insulin resistance. Another factor, of course, inflammation. Inflammation is a driver for insulin resistance, and inflammation can come in different forms. Like if you have food sensitivity, right, that can be environmental toxin. Um,
Mm.
um, yeah, so plastic, microplastics. I think Dr. Bigman has a podcast on in the
I saw
metabolic
that.
classroom talking about microplastic as
Mm.
well. And then from my field, medications can lead to insulin resistance
How's that?
directly. Well, one of them is my pet peeve, statin.
Mm.
If like that is the most prescribed cholesterol lowering medications, right? That's my fast mover. And if you look at the side effects, go ask your pharmacist, or you can just Google. You can go into
Drugs.com.
pdr.net. Yeah,
Mm.
pdr.net, put in statin, any of the statin. Look at the black box warning.
Mm.
Directly increases HbA1c, puts you at risk for type 2 diabetes. And type 2 diabetes is more linked to
Mm.
cardiovascular disease. So if you can Google, you can look up like what's the number one cause of death today? It's still cardiovascular disease, right? And statins use has been on the increase for you know
And that's not caused from eating
149%.
eggs.
No, that's not caused from eating eggs. That's caused from eating sugars, carbohydrates, vegetable oils, seed oils, all these
Hmm.
that causes inflammation. So food leading to inflammations from the seed oils, very
Hmm.
pro-inflammatory, and this can lead to insulin resistance.
Hmm.
So the big factors, risk factors, food, of course, that's we can control that, the food, what we put in our mouth, inflammations, like I said, and then stress. Those are the three big factors that,
Chronic stress, chronic
yes,
inflammation, and chronically
yes,
eating carbs, probably excessive.
exactly,
Hmm.
exactly. It's all this chronic, habits are the,
Mm.
you know,
Yeah, it's not ever, I always
modern,
say cute is not that, is more when things get to be chronic, it never ends in a positive finish.
right,
Is
right.
we have to
Yeah,
find the right
yeah.
Goldilocks effect. So
Hmm.
going into the insulin resistance signs and symptoms, you talked about some of them, and then the
Hmm.
chart you have behind you, Ben Bickman has shared
Hmm.
in his book. Speak to a little
Hmm.
bit of anything in there you feel comfortable diving into that's kind of hot that maybe as we speak to more endurance athletes that are exercising, but they might still have side effects of signs and symptoms of insulin resistance because of chronic stress and chronic inflammation. But also, I would say a lot of athletes eat excessive carbohydrates and too much sugars for their exercise, especially endurance athletes should be doing they're burning more fat ideally than carbohydrates, so they don't need the excessive carb intake that most people do. So
Hmm.
anything to do with signs and symptoms of insulin resistance for those that are active individuals.
Yes, no, great questions. Yeah, so I'm pretty active. I practice hot yoga and I like resistance exercise. So muscle is your biggest glucose
Yeah.
consumers, right? So as we get older, we want more muscle, and it takes a little more effort to
Yeah.
maintain the muscle, to produce the muscle. And we do require a little bit more protein to produce the same amount of muscle. So
Hmm.
focus on that too. And then, yeah, there's the questions like, especially athletes, people who are active, do we need to eat carbohydrates before we work out? It seems like a lot of people think that you have to eat carbohydrates before you work out. I work out in a fasted state. And yeah, actually, especially, um, well, I drink this tea. It's a concentrated yerba mate tea that Dr.
Mm.
Bickman drinks himself and did research on. And I drink this tea as a pre-workout drink, and this
Mm.
tea helps to increase muscle efficiency, helps my body to produce more ketones. So I have this energy
Mm.
and I don't get fatigued. I don't get tired during my workout.
Yeah.
Whereas if you eat carbohydrate and go work out, it's like, your body has to spend some energy processing those food, right? So that's a piece about that. But another guided I want to talk about is the blood pressure and the salt, right? So salt, people is like, oh, you need to eat low salt if you have high blood pressure. It's like that's totally the opposite. It's like salt does not cause high blood pressure. It's insulin resistance causes high blood pressure by so many mechanisms. One of them is that it increases a hormone called aldosterone. Aldosterone signals the kidneys to hang on to salt. So where salt goes, the water goes, right? And that'll increase in blood volumes and that'll increase in your blood pressure. And then the second mechanism is like we touch upon stress. Insulin resistant increases your sympathetic nervous system, and that will increase your heart rate, increase your blood pressure. And then another mechanism is that it decreases nitric oxide
Mm.
in the body. So nitric oxides require
Mm.
it causes blood vessel dilation. So when you have less of that, it causes constriction, and that can lead to blood pressure. There's
Mm.
just so crucial to just address insulin resistance. I think it's easier than many people think.
Yeah, I just feel that it's just so unknown unless you get your insulin tested. And I think you have to go to your doctor and ask for them to test your insulin, part of your checkup. Ideally, get blood work more than once a year. And you have to say it's kind of crazy, but for them to get it covered by insurance, which I can go on Rupa Health or Ulta Labs, Direct Labs, and get
Hmm.
it for
Hmm.
$15.
Yes,
But for the
yes.
doctor to take it, they need to run it through insurance. And they have to
Hmm.
say, you have to say, I have diabetes in my family, type 2 diabetes, or say something. Same to get a full thyroid panel. You have to say you have all these symptoms for them to code it as
Hmm.
like get your free T3 measured. So with insulin, I find it really hard to get done. And if your doctor won't do it, don't have them run it, take it, and then go through insurance because they'll charge you gazillion dollars. I tried doing that and I got a bill for $1,000 for all these labs. I'm like, I could get them for $200 all done. So,
Yeah.
one, get your insulin tested, but go, I'll put the link to Ulta Labs. It's so affordable. And
Hmm.
I know in our FDN ranges, we say you want to be optimal is 1 to 5, but Ben Bickman says up to 6 is
Hmm.
okay.
Hmm.
And pack that because I test everyone and they always have high insulin levels.
Hmm.
And you need to know this marker, I think, is more important than knowing what your total cholesterol is.
Hmm.
But I'm not talking.
That's elevated total cholesterol. Automatically, you'll be recommending a statin. And there's two parts to the LDL. There's like, there's a particle A and a particle B. And we can't just prescribe medication just because you have high LDL. So definitely, I think, some doctors are measuring the particle size now, like the particle A and the particle B. The A, which is the big and fluffy, which is we need cholesterol. We need cholesterol for hormones. We need it for immune system. We need it for gut health. We need it for brain health. That's why it's like if you are reducing and inhibiting the pathway, the synthesis of the particle A, the big fluffy cholesterol
Mhm.
that you need for your brain. I'm wondering why Alzheimer's on the rise, right? And um, there's just so many problem with that, and where we should be focusing on triglycerides. All right. So that's another thing. That's another thing that that your audience can do. Everybody has the annual lab works. Look at triglyceride and look for HDL. Take the triglyceride divided by HDL. If
Mhm.
that number you want that number, you want that ratio to be less than 1.5. Dr. Bickman, said that that's a poor man's way of calculating what if you
Yeah.
have an insulin resistance. Yeah, so that's
Mhm. I
another way
heard
that
that.
you can do. Yeah,
Mhm.
exactly. And if the ratio is greater than 2, most likely you have insulin resistance. And
Mhm.
with 93% adult American consider, pre-diabetic, have insulin resistance, many people, if they do the calculation, they usually find themselves in that range, insulin resistance range.
Now, you lost your parents from type 2 diabetes.
Yes, yeah.
Did
Oh,
they have,
complication
yeah, complications
related.
of?
Mm-hmm.
Because I know I was thinking of this. My own dad had heart issues, but
Mm-hmm.
then when he went back to the hospital 10 years later after having a heart attack, it was kidney issues.
Mm-hmm.
And I always look at it like, okay, didn't you have liver detox pathway issues from all the
Mm-hmm.
medications they give you and
Mm-hmm.
kidneys? And what is the role of insulin in that as well? And they don't ever look at that because they're looking at 3 doctors are looking at each area. So you have the heart doctor, the kidney doctor, the cancer doctor. It's not an integrated approach that you look at that infographic. It's all coming to Ben Bickman's theory is insulin resistance and how they're all related. But when we
Mm-hmm.
go try to improve our life and live a long quality life and get out of the hospital for people struggling, you get all these different people working on different areas, not working your body as a whole. So it's very sad how many people I feel like could live longer quality life if they had right approach of integrated medicine.
Absolutely,
Absolutely.
absolutely. This is just one body, right? It's like
Yeah.
your brain does not work independently of your gut, or, I mean, gut brain axis, gut skin axis. Gut is linked to everything, right? Most of your
Yeah.
immune system is produced in your gut. Serotonin is produced in your gut. So it's like your mental health, your everything is all interconnected.
Yeah.
We can't just treat one body part and think that, that won't affect the others. So, and the most important, yes, address your liver. Your liver is your body's soccer mom. It does everything. It's like stores everything, right? Remove everything and just make sure that everybody is functioning and playing nice with each other, but we just ignore. And what's so sad for me right now is that 36% or so of children are dealing with non-alcoholic fatty liver disease.
Yeah.
And right, I mean,
Yes.
because and it is very sad because juice, cereals, all the processed foods that we feed our children. I'm guilty of that. When I was a young mom, when my son was like 2 or 3 years old, the breakfast was Pop-Tart. I remember that. I
Well,
remember buying,
it's affordable, right? I mean, people can't afford.
it's
I think
convenient.
it's convenient. It's not that it's not affordable, but I think it's just convenience food that's in a
Hmm.
package and you can just grab
Hmm.
it and give it to your
Hmm.
family.
And it's
But
delicious, right? And it's addicting, right?
well, if I had it now, I'd probably want to be sick because I'm so sensitive to
So
toxic foods that I wouldn't be able to eat it. But
yeah, I call myself like, the health snob, the
yeah,
food, like my body can't, like, even dark chocolate. I just had a piece and it's like that is just too sweet for me. I
yeah,
mean, it just everything is too sweet for me now because
I
my
say,
body is so clean and so
yeah, we're a
sensitive
temple.
too. Yeah, exactly.
I would
It's
say I'm
like,
just high maintenance. So that's why you have to hang out with people that are in your tribe because you don't really get people judging you because
yeah,
you're
yeah,
not like some
yeah.
stranger. Like, oh my God, we have Debbie and Neil coming over. We can't have this, can't have that. It's just you got to hang out with your own people. So I think going back to figure out, I always keep saying lately, order of operations. To be a health optimizer, maybe you have some signs and symptoms that we can go into, but really being preventative is my goal in the show. Figuring out in advance before you have insulin resistance. So let's take a step back. We said getting your labs done. And I say, every 3 to 6 months, but for sure, knowing what your number is for insulin
Mm-hmm.
is step one. And then
Mm-hmm.
you get your results back and say you're 6 or higher. Maybe you're
Mm-hmm.
like everyone seems to be 15 or 20 or something.
Mm-hmm.
What would the
Mm-hmm.
next step be if you find that ideally work with a coach to figure this out? Because as we said, it's not just nutrition. And that's my
Mm-hmm.
experience. It was chronic stress that drove my
Mm-hmm.
insulin resistance. So walk us
Mm-hmm.
through kind of what you learned from Ben Bickman, order of
Mm-hmm.
operation.
Order operations. I think the what we can control is shift away from lower your carbohydrates intake, like lower the processed food, remove processed food, remove refined sugar, and prioritize protein, and don't be afraid of healthy fats. And we are right now a society of fat phobia, right? I've been told to eat low fat, I don't know, for the past 30, 40 years. So don't fear fat, and except for vegetable oil and seed oil, of course, fear those, and focus on fiber. So the focus on these three things. And if you need help, there are supplements, there are tools that can help naturally. Like right now, I dispense a lot of injections, the GLP-1 agonist injections that has potential severe side effects. There are supplements, there are natural ingredients that can do the same thing, that can help your body stimulate your own body's production of GLP-1 and suppress that cravings for carbs, for sugar. And in addition, eating the fat, protein, and fiber will help to shift and also reset the gut microbiome. So when we rebalance the gut microbiomes, we won't have those cravings and also those crazy um, need for sugar. And then of course, water. Many of us are dehydrated. We don't get enough minerals, especially magnesium. Many of us are deficient in that. Um, yeah, drinking adequate amount of water is key. Um, Eating to balance your blood glucose and
Hmm.
lower your insulin levels. And of
Hmm.
course, prioritize your sleep to reduce stress.
Yeah.
it's all interconnected. And then go outside 20 to 30 minutes a day in the morning if you can, right? And
Yeah.
move. Just move like a half an hour a day and focus on resistance exercise if you can, to
Yeah.
build more muscle.
I'd say move throughout the day because I keep trying to share on my platform that just because you got up and worked out doesn't mean you can sit all day. So that's why I like to trigger breakfast, lunch, dinner means, oh, I need to move and
Mm-hmm.
ideally move every hour. But
Mm-hmm.
I think people think that they exercise, they don't process that. I need movement and exercise are two different things in my world. That you need strength training, we need the cardio and sprints, and then we need movement. And
Mm-hmm.
especially after you eat, moving. And it doesn't have to be walking because I think people figure out, oh, I don't have time to, or it's dark out, it's cold, it's snowing, or wherever they are, that I need 10, 20 minutes. I just like get up and move and do the dishes or do chores. Just movement is the priority after you eat to help all this,
I
right?
love it. I love it. Yes, I love that. Yeah, after you eat, do your dishes, clean the
Yeah, I
kitchen,
mean, I'm
right?
I'm moving around. I'm not going to
Mm-hmm.
go sit on the sofa. I'm moving
Mm-hmm.
around and doing chores. So I think timing that so after you eat, you're not just, oh, I just ate, sitting down, focus eating and chewing my food, but then I go sit on the sofa and watch 3 hours of TV.
Mm-hmm.
That's where I think
Right.
people get in trouble is that they're just sedentary and they don't really pay attention to that lack of movement. But before we move on, the GLP-1, and you said there's different supplements. What have you heard about for helping people with that? Because I know like apple cider vinegar, Pendulum has some probiotics out. There's different things, berberine,
Absolutely.
anything.
Absolutely. Yes. So yes, berberine, turmeric, those can stimulate GLP-1. Anything that's bitters, right? Bitter
Mhm.
greens, dandelion, bitter melon. My mom used to eat bitter melons
Yeah,
because, it's good for, lowering glucose, lowering blood glucose.
yeah.
Um, yerba mate tea. Dr. Andrew Huberman did a whole, YouTube on yerba mate tea, and that's what I drink here. So this is my drink here. So this is what Dr. Bickman did a study on. This is what he drinks too.
Let's
And
look that up.
then, yeah, look that up. But brand matters. So what we drink here is a concentrate. So what the one that Dr. Bickman did a study on, this is mine. It's not trying to advertise, but this is what I drink, and this is what Dr. Bickman drinks. So that's what I'm drinking.
Yeah.
It's an extraction, so it has like 375 times the amount of the chlorogenic acid in this tea compared to the yerba mate tea you'll find out
Mhm.
there. So if you're going to drink something, drink the best and drink the purest because this is organic and it undergoes a purification process. It is an extraction and it undergo a third party purification processes. So
So
that's
not
why.
the canned stuff at the grocery store isn't the same.
No, that contain more sugars and more additive stuff in there, and it
Yeah.
doesn't have the amount of chlorogenic acid as this one does.
Mm.
And yeah, so you can stimulate, eating protein can stimulate your own body's production of GLP-1. Movement can stimulate that. When you exercise, it can
Hmm.
stimulate your GLP-1. Notice like when you exercise, I don't know, for me, after exercise, I don't feel hungry.
Yeah,
That's
me
part of
too.
it.
Yeah.
That's part of it. Yeah.
Hmm.
Yeah. So
That's a
there
good
are
and
things
bad
that you
thing.
can do. Yeah. Yeah.
We're not getting our
So
protein
absolutely.
in. Trying to hit the protein goals is a struggle because you're full if you eat and
Hmm.
chew your food and digest it properly. You're full and satiated, but then you're
Hmm.
not hitting
Hmm.
enough. Like I'm trying to get a certain amount throughout the day that it's so filling and satiated that I'm like, oh, I don't want to eat again. But
Yeah, well, I
I'm
try to
sure.
get like 3, 4 eggs in each day and just eat more fatty meat because, all proteins in nature comes with fat, right?
Yeah.
So,
Yeah.
eat the ribeye
I
if you're a
know.
meat eater, and if you're a vegetarian, it's have to be a little bit more mindful.
Yeah,
of
I've
keeping
talked
the
about
carb
that.
low, right? To keep the carbs low and get your protein. So it's a little
Well,
bit more challenge.
it is. It is for sure. I
Yeah.
did the calculations. If you're doing vegan or vegetarian, trying to get muscle protein synthesis, the right essential amino acid profile with the right leucine threshold, you
Mm-hmm.
to get the right dose to stimulate your muscles, you're eating like 2,000 calories, and it was like 3 cups of black beans and quinoa. I mean, it was a ridiculous amount that no one could even eat that much. So it doesn't really
Mm-hmm.
work. So I
Mm-hmm.
think you have
Yeah.
to supplement when you can't get enough in. If you are a vegan vegetarian, that's great, but just beware you're going to have to take a lot of additional supplement sources as like we talked about perfect aminos or something
Mm-hmm.
else because it's so hard. But anyway, so
Absolutely.
with insulin resistance, what's your goal on your program, Insulin IQ? You're trying to create awareness of the root cause, how things are contributed to insulin resistance. What are things are you working on to help share this?
Just very, very simple protocol, very simple protocol. So we have two plant-based supplements that we, like I said, tea is one of them. I just drink this first thing in the morning in a fasted state, and that will help to suppress my appetite. When I break fast, I drink a fiber matrix, something that's been studied by the Cleveland Clinic that has shown to decrease postprandial glucose up to 40, up to 37%, 34 to 37%. But the latest study that Dr. Bickman did earlier in March of 2024, somebody had 2 waffle maple syrup and an orange juice, taking the fiber matrix prior to that, um, he was able to see a reduction about 43% postprandial glucose. That's more than metformin. Metformin can reduce 20 to 30%. And then the Cleveland Clinic did a study on this fiber matrix. Um, the result stating that if this was taken on a regular basis, on a population basis, it can reduce the need and the dose for lipid lowering drugs. So that's huge. That's a natural statin, what you got there. So
Mm.
there are supplements that that people can use, and that those are the two supplements that I recommend that people try first because it's affordable and it can produce quick results. Um, Combining with intermittent fasting, I'm able to help people lower A1C, reduce triglycerides, improve HDL, and restore their metabolic health naturally in 3 to 6 months. And I was able to help my mother-in-law reverse her type 2 diabetes in 8 months, and she's had it for 15 years. So it doesn't matter if you have type 2 diabetes, cholesterol, blood pressure for, a long time, you can still do something about it.
What would you say is the definition of reversing type 2 diabetes? Do you have your fasting glucose 70 to 90? What would be the markers for reversing type 2 diabetes or insulin resistance? That you're in optimal range?
Um, we focus on the A1C. If your A1C is, below 5.4.
Mm.
So, and again, the triglyceride over HDL less than 1.5. And my mother-in-law was like 7.2 when I started her in January of 20, no, February 2024. And then by September, she was 5.8. And then by like 3 weeks ago was 5.4, no
Okay.
longer diabetic. So it's really, diabetes is not a progressive disease like we were told. That I was taught that if you have type 2 diabetes, it's progression. It's progressions because you don't address the diet. If you don't you don't address the root cause. Of course, if you're only using medications to treat the symptom, it's gonna progress, right? It's gonna get worse and worse if you don't address the root cause. But if you address the root cause, it is 100% reversible. I've seen it, not just with my mother-in-law and my own family, but thousands of other people.
So what would you say is happening? I know Ben Bickman talks about this. If you are type 2 diabetic and you're doing the traditional method of treating your diabetes with insulin, what is that doing to your health? You
It's
think
just going to get worse. It's just going to
about
create more inflammation. It's just going to eventually can end up with double diabetes, meaning you can exhaust your pancreas. Your pancreas can, you know, the more it work, the more that you're making it pumping out insulin constantly, that pancreas is gonna die. So I actually have a friend who's on her way to type 1 diabetes. She's been type 2 diabetic for over 20 years, and her doctor said she's on her way to type 1. Her pancreas is shutting down.
wow.
So you can have double diabetes if you don't address the root cause, if you keep using just medications and insulin to just treat the symptoms and not address your and not do something through lifestyle to bring down the insulin, because you if you're just treating the symptoms, yes, it'll only get worse, and then you'll have other symptoms because medications have side effects, right? Especially like metformin. So you're taking metformin, right? The side effects, one of the side effects of metformin is B12 depletion, and you need B12 for nerve, right? For nerve regenerations. And many people have neuropathy pain when, yeah, so due to low B12 or and insulin resistance. So it's too much sugar causing glycations, causing damage to the nerve. So there's like a video out there. It's like I forgot who put that out. It's like sugar in the brain causes Alzheimer's, sugars
Yeah,
in the eyes cause retinopathy. Have you seen that one? It's
yeah,
like I
that's a
love
good
it.
one.
Yeah,
Yeah,
that's a good one, right?
long
So
time
it's
ago.
like sugar in the kidneys, like
Yeah,
sugar. Yeah, so it just
sugar in the
causes
also
so
looked at
much.
it.
Yeah, exactly. It causes damage everywhere. So glycation.
Yeah, glycation, sticky jam jar. That's what I was heard in nutritional therapy school of glycation is the jam jar and the jam gets outside and you can't take the lid off because it's all sticky. That's what your cells
Hmm.
are when they're glycated and your A1C is high. But before
Yeah.
I this aha moment, so many people are on statin drugs and metformin. So the side effects, I gotta look this up. Side effects of statin drugs and the side effects of metformin, how that is impacting your health. And you're depleting B12 from metformin, but you're taking metformin to lower your blood sugar, manage pre-diabetes, or you're prone to diabetes. Because I have clients that are on this, like, I don't know.
Here's one more thing. Here's one more thing. Like I think there's a study that just came out. Dr. Bickman talked about that in the latest lectures. I don't know if it's on the podcast yet. Metformin leading to inhibiting muscle productions because due to myostatin. So if you're on metformin, right, you want to lose weight. Your doctor tells you you should lose weight. You need to lose weight. So you take on metformin to lower your glucose. So, Debbie, you're going to go to the gym 5 days a week to go exercise. Guess what? If you exercise, you're taking metformin, your body inhibits you from producing the muscle. It causes in is cause your body to inhibit the muscle production
So anabolic
process through the mTOR.
resistance.
Yeah, exactly. So it's like you're in this loop, you're in this vicious cycle that you
Yeah.
can't get out. So if you just address the root cause, it's very simple. I tell people it it's it's still it really is simple. It really is that simple. It's so simple that people don't believe me.
Yeah, I know we're out of time and I'll have to do I have so many rabbit hole thoughts to do extra videos on this because people are trying to be healthy and they trust their doctor and they get these medications, but they're causing different problems. And so you get this domino effect that you don't connect the dots that this is all related because of taking this medication or that medication. So it might be helping this area, but it's causing something else
That
breaking down.
Right. So it
So
helps
yeah,
this, but it caused that. It helps
yeah.
that, but it caused that. It's just like, what if you just address that and then you can take care of all that? And especially when addressing this is more simple than most people think. I mean,
But that's why
it
we need coaches because no, most people that are insulin resistance, even if they're athletes, they don't know or choose to deal with the root cause because it's not instant. It takes, as you
mhm,
said, months, and it takes consistency and finding what works best for you to create new habits of stress management, sleep hygiene routine, movement throughout the day, how you exercise, your frequency, intensity, duration. I mean, there's so much to it. Or you could just take a pill. That's the
right.
problem we have, right? It's just
Yes,
easy, quick fix. But then we just showed your pill that you're taking is causing other issues. So if your goal hopefully is improve your future self, so you're striving as you age, not struggling and being traveling the world at age 80, 90 years old. That's why I think we have to look at the whole picture and not always go the easy route that causes more
right.
problems.
Right. Yeah. You seem like that. See, address the root down there.
Yeah, that's my favorite symbol. I got
Right, right.
the
Yeah,
tree, the root of the
all
trees.
these, yeah, all these diagnoses and symptoms are just branches of those trees. They're just,
Yeah,
if we address the root, we can take care of all those
yeah,
branches.
a
Yeah.
holistic approach. Well,
Mhm.
thanks, Amanda. Where can people learn more and follow you and connect?
Yeah, so come to Functional Foodie RX. We have a Facebook group where all the coaches come together and to raise awareness and share
Mhm.
tools. And uh, mine is Restore Digestion. So my website is restoredigestion.com. So you can find all my tools in there. I teach yoga. I teach a neurofascia technique to get people, out of chronic pain. And of course, insulin IQ and feel great system. So all that, all the natural tools I have, it's in Restore Digestion because address your gut and
Yes, so with you. Well, thanks for all that you're doing and sharing. And if you guys are on LinkedIn, you can find us there as well.
mhm.
And really learning a lot about GLP-1, insulin resistance over there. So if you get in the more, it's not about finding jobs. It's a great way to connect with other professionals and help us share research on there too, is what I love, the different
Yeah,
resources there. So it's a great
I
spot.
love it. I love it. I think we just all need to come together, interdisciplinarians, and just as a collective and raise
Yes.
awareness and help each other and help people heal from the root. I think we can make a little dent in the sick care system. What do you think?
Right. We're trying. Do it again. All right. Well, thanks, Amanda. I love this information and love Insulin IQ's on my list to do this year, actually, their program, but Ben Bickman, and we appreciate you paying it forward too, sharing that information. So, because it takes a team. So, all
Yes, yes, come and join us. It's a great community.
right. Thank you.